Okay. For applying a fecal management system, you first identify the patient using at least two identifiers, their name and date of birth. You review their medical record for any contradictions for use of a fecal management system. You assess their frequency and amount of diarrhea over the last 24 to 48 hours and make sure they don't have an allergy to silicone. You come in, introduce yourself. After you identify your two patient identifiers, you wash your hands and apply gloves. You perform perinatal hygiene, observe the patient's anal region for swelling, hemorrhoids, redness, irritation, or drainage. The presence of these may find contraindicating for the placement of the device. After that, you change your gloves and perform a digital rectal examination to ensure that there is no rectal impactation. Then you remove and discard gloves. Perform hand hygiene and get some new gloves. You get the fecal management kit and prepare the system by connecting the collection bag to the catheter tube assembly. You deflate the cuff, usually done with 60 millimeters of syringe supplied by the kit. Fill the 60 milliliter syringe with 45 milliliters of tap water and attach the syringe to the inflation port. You don't inflate it at this time. The inflation port is color coded. You position the patient in the left knee to chest position. This helps maximize the sphincter relaxation, and you put a pad underneath them to help prevent any fecal matter getting onto their sheaths. That's usually under their dominant hip. You fold the cuff according to the manufacturer's directions and lubricate the cuff. Generously lubricate anal sphincter and gently separate the patient's buttocks, exposing the perianal area for the entire procedure. Make sure that the area is clean and dry. It may be necessary to perform hygiene again in that area. Insert the cuff using the index finger as a guide. Once the cuff is in the rectal vault, it will open to original shape. Inflate the cuff with 45 milliliters of water by slowly depressing the syringe plunger. Remove the syringe from the ejection port and gently pull on the catheter to ensure that it seats against the rectal floor. Note the position of the indicator line in the patient's anus. Changes in indicator line may indicate the need for the cuff to be repositioned. Remove the gloves and perform hand hygiene. Irrigate the cuff as needed. Fill the syringe with 45 milliliters of tap water. Attach the clear irrigation port. Observe the flow, but if leakage occurs, the cuff may be repositioned if needed. If stool sampling is needed, use a sample port. Once the sample port is finished with the sample collection, you could always remove your gloves and perform hand hygiene. Replace the collection bag as needed. Perform hand hygiene and apply clean gloves every time you do this. Disconnect the drainage tubing from the collection bag. Attach a new bag if necessary to the hub. Dispose of the fecal contents per agency policy, and you just remove your gloves and perform hand hygiene. When you're removing the fecal management system, perform hand hygiene, apply clean gloves. You attach a depressing syringe to the cuff infusion port and slowly withdraw the water. Once it's deflated, grasp the catheter as close to the patient as possible and slowly slide it out of the patient's anus. Dispose of it per your agency's policy. Position the patient in a comfortable position and perform any hygiene as needed. Monitor the patient for any diarrhea or record any amounts on intake and outtake. And also record the appearance of skin as well and any discomfort of the patient or pain.